Chapter 50, Care of Surgical Patients. Perioperative nursing includes a registered nurse's planned patient-centered approach in providing care to patients preoperatively, intraoperatively, and postoperatively through the application of national practice standards. The registered nurse's role in providing quality patient care before, during, and after surgery is crucial in maintaining patient safety. When preparing the patient for surgery, the nurse will have to keep in mind the patient's culture as well as the patient's medical history. Types of surgical procedures are classified according to their seriousness, their urgency, as well as their purpose. The student nurse's father's recent surgery will help the student nurse relate to patients as well as to the patient's daughters. Surgical patients who smoke are at a higher risk for developing pneumonia, atelectasis, and delaying wound healing. The very young and older patients are at a greater surgical risk due to an immature or a declining physiological status. Tissue repair and resistance to infection depend on adequate nutrition. Surgery increases the need for nutrients. Patients who are morbidly obese typically live up to 14 years less than their average weight counterparts. Patients that have obstructive sleep apnea who are to undergo surgery present a significant risk. Receiving sedatives, opioid analgesics, and general anesthesia causes a relaxation of the upper airway and may worsen obstructive sleep apnea. Patients that have conditions that alter their immune function, like primary immune deficiency, AIDS, cancer, or organ transplants, are at an increased risk for developing an infection after surgery. The individual's body responds to surgery as a form of trauma. Severe protein breakdown causes a negative nitrogen balance and hyperglycemia. Both of these will decrease tissue healing and increase the risk of infection. Postoperative nausea and vomiting will affect about 30% of the patients in the recovery room after surgery. It may lead to serious complications that include pulmonary aspiration, dehydration, and arrhythmias that can result from both fluid and electrolyte imbalance. Transitions from one healthcare provider to another will place patients at risk for injuries, missed care, and errors in translating information. Nursing research has shown that having a standardized checklist or a protocol for handoff communication between the perioperative healthcare providers will minimize the risk. Evidence also supports a relationship between wound and tissue infection and surgical patients' blood glucose levels. Poor control of blood glucose level or hyperglycemia during and after surgery will increase the risk for adverse outcomes. Nursing research does reveal that patients are at risk intraoperatively for pressure injuries due to the result of intrinsic, extrinsic, and specific OR risk factors. Intrinsic risks are the patient's tolerance to a pressure injury. Can be altered nutrition, decreased mobility, older age, decreased mental status, infection, impaired sensory perception, and comorbidities with other disease processes. Extrinsic factors are variables that increase the tissue susceptibility to sustain external pressure. These are temperature, friction, and shearing forces, as well as moisture. OR risk factors include the length of the surgery, the position on the operating room table, the positioning devices that are used, the warming devices, anesthetic agents, intraoperative hemodynamics, and the length of time on the OR bed. Patients that have surgery enter the healthcare setting at different levels of health. The ability to establish rapport and maintain a professional relationship with the patient and the patient's family is essential during the preoperative phase. The goal of the preoperative assessment is to identify a patient's normal preoperative function and the presence of any surgical risks, as well as to recognize, prevent, and minimize possible postoperative complications. The extent of the nurse's assessment depends on the patient's condition, the surgical setting, the time the nurse has available with the patient, and the urgency of the surgical procedure. The student nurse's prior knowledge of surgery will help her understand the needs of her patient. Some patients will require a more detailed nutritional assessment to determine their surgical risk. Allergies to medications, latex, and topical agents that are used to prepare the skin for surgery may create significant risks for patients during surgery. It is vital to note all the risk factors before surgery. This is why the pre-admission history and physical examination findings are so critical to the outcome. Screen all patients for a history of smoking that include cigarettes, cigars, electronic cigarettes, and pipes. The habitual use of alcohol or illegal drugs and the misuse of prescription drugs will predispose patients to adverse reactions to anesthetic agents. During the preoperative assessment, routinely ask women of childbearing age who are scheduled for surgery about their last menstrual period and if it was typical for them. A patient's past experience with surgery will influence potential physical and psychological responses to the procedure. Does anything the patient said stand out or provide information that will help decide how to assist the patient? Think about the nursing diagnosis that would be chosen. Surgery often results in physical changes and restrictions that prevent an individual from immediately returning to work. Surgery is psychologically stressful and creates anxiety in patients and their families. Patients often will feel powerless. Patients with a positive self-concept are more likely to approach surgery with optimism. An individual's personal and social identity, combined with the sense of competence in meeting one's own basic needs, is a powerful resource for coping with the surgical stress. Culture is a system of beliefs and values that are developed over time and passed on through many generations. Understanding the patient's cultural background will assist the student to establish a relationship with the patient and will help the student care for the patient. The student needs to understand the patient's culture and use the patient's information. Maintaining circulating blood volume is critical for any patient undergoing surgery and is accomplished with administration of whole blood or blood products as needed. The nature of the surgery and the assessment of the patient's health status will provide assessment findings and risk factors for a number or numerous different nursing diagnoses. Successful planning requires a patient-centered approach that involves the patient and the family to set realistic expectations for their care. Early involvement of the patient and the caregiver when developing the surgical care plan will minimize surgical risks and postoperative complications and improve the transition of care through discharge. Notice that the family members are included in the patient's plan of care. Except in emergencies, surgery cannot be performed legally or ethically until a patient fully understands the surgical procedure and the implications. When a consent is obtained preoperatively, it must be done before the patient receives any form of sedation to ensure a clear level of consciousness at the time of signing. It is the surgeon's responsibility to explain the procedure, the associated risks, the benefits, the alternatives, and the possible complications before obtaining the patient's oral and documented informed consent. Patient education is an important aspect of a patient's surgical experience. The topics and the principles discussed will depend on the type of surgery that is scheduled, whether a procedure is an inpatient or an outpatient, and the ability of the patient to attend and learn the content provided. Patients are better prepared to participate in their recovery when they receive rationale and understanding for the preoperative and the postoperative procedures. Explaining the preoperative routines that a patient can expect is beneficial. Rest is an essential part for normal healing. Patients who are prepared for surgery experience less anxiety and report a greater sense of psychological well-being and satisfaction. Teaching focused on information the patient will need to know on the morning of admission will decrease their anxiety and allow the patient and the family to better participate in the care. Expressing feelings and fears will decrease anxiety related to the surgical experience for the patient, and this will allow teaching to be more effective. Preoperative teaching improves the patient's ability to ambulate, participate in their own care activities, and resume their activities of daily living after surgery. A return demonstration of exercises will verify that learning has occurred and that the patient is able to correctly perform exercises to reduce postoperative complications. A surgical site infection is one of the National Quality Forum incidents that hospitals must report. A patient having surgery is vulnerable to fluid and electrolyte imbalance as a result of the stress of surgery, inadequate preoperative intake, and the potential for excessive fluid losses during surgery. The elements of a preoperative to intraoperative handoff using an SBAR communication. For situation, the name of the patient, date of birth, name of the operative procedure to be performed, including site and modifiers, pertinent documents, which is a consent, and any test results must be present and consistent. For background, the elements of the patient's history that are pertinent to surgery, medical clearance, patient's allergies and NPO status, patient's vital signs and pain level, the medication profile and medications taken the day of surgery, laboratory results, imaging results, the code status of the patient. For assessment, the patient's current level of understanding of the procedure, special patient needs, risks, or precautions, the pertinent cultural or emotional factors, any anesthesia requests. For recommendations, state whether the patient has been seen before surgery by the surgeon and the anesthesia care provider. Determine if the patient is ready for surgery. Allow the chance for all staff members to ask questions and voice concerns. The three principles of the universal protocol are: number 1, preoperative verification that ensures all relative documents, which are consent forms, allergies, medical history, physical assessment findings, the results of the laboratory tests and diagnostic studies. They are all available before the start of the procedure, as well as the type of the surgery that is scheduled is consistent with the patient's expectations. Number 2, marking the operative site with indelible ink to mark the left and right distinction, multiple structures, and levels of the spine. And number 3, a timeout just before starting the procedure for a final verification of the correct patient, procedure, the site, and any implants. Due to limited time being available to evaluate the outcomes before surgery, compare the patient's current status with expected outcomes to determine whether new or revised interventions and/or nursing diagnoses are needed to be implemented intraoperatively. During the evaluation process, include a discussion of any misunderstandings so that the patient concerns can be clarified. When patients have expectations about pain control, this is a good time to reinforce how it will be managed after surgery. The patient's daughter, remind him to hold his breath for 2 to 3 seconds when using the incentive spirometer. Were the outcomes achieved? The patient demonstrates a good understanding of the surgery. The patient verbalized concern and support was provided by the daughters. The patient demonstrated coughing, deep breathing, and leg exercises appropriately. The patient requires further demonstration and assistance from his daughters in the use of the incentive spirometry. Is there anything else that the student could have done to help prepare the patient? She could ask the patient if he has any questions about the nature or the purpose of the surgery. She could review with the patient and the daughters the events that will occur in the holding area and in the post-anesthesia care unit. She could ask if they are frightened about any aspect of the procedure or the routine, and she could address their concerns. A patient transporter or a nurse in the holding area will check the patient's identification bracelet for 2 identifiers: name and birth date or hospital number. This will be checked against the patient's medical record to ensure that the correct patient is going to surgery. Nurses in pre-anesthesia care are members of the operating room staff and wear surgical scrub suits, hats, and footwear in accordance with infection control policies. The patient will remain in pre-anesthesia only a brief period of time. An important aspect of intraoperative care is safety of the operating room personnel. The operating room environment poses its own unique risks that can result from procedures, Members of the surgical team can suffer from skin, sticks, or cuts, or mucous membrane exposure to contaminated body fluids. The proper use of personal protective equipment is critical. The circulating nurse is a registered nurse who does not scrub and uses the nursing process and management of the patient care activities in the operating room suite. The circulating nurse will also manage the patient positioning, antimicrobial skin preparation, medications, implants, the placement and functioning of any implanted devices, the specimens, the warming devices, and surgical counts of instruments and dressings. The scrub nurse may either be a registered nurse or a surgical technologist who is often certified. The scrub nurse must have a thorough knowledge of each step of the surgical procedure and the ability to anticipate the instrument and the supplies needed by the surgeon. The circulating nurse in the operating room thoroughly assesses the patient and critically analyzes findings to make patient-centered clinical decisions required for safe nursing care. As the incidence and the prevalence of latex sensitivity and allergies continues to increase, the need for recognition of potential sources of latex is extremely crucial. All medical supplies contain a label notifying the consumer of the latex content. Signs and symptoms of a latex reaction may include local effects that range from urticaria and flat or raised red patches to vesicular scaling or bleeding eruptions. Acute dermatitis is sometimes present. Rhinitis or rhinorrhea are other common reactions to mild and severe latex allergy. The nature and the extent of a patient's surgery and current physical status will influence the type of anesthesia administered during surgery. The prevention of positioning injuries requires anticipation of the position and surgical approach to be used, the positioning equipment available to be used, and whether a patient has conditions that can cause a risk for injury. Throughout the surgical procedure, the circulating nurse will keep an accurate record of the patient care activities and the procedures performed by the operating room personnel. While a patient is undergoing surgery, it is important to keep the family informed. The circulating nurse monitors and records the intake and output, the specimens obtained, the medications and irrigations, the type of the dressing or packing, and any other treatments provided during the operating procedure. When conducting preoperative patient and family teaching, you demonstrate proper use of the incentive spirometer. You know that the patient understands the need for this intervention when the patient states, "I use this device to help my cough reflex, expand my lungs after surgery, increase my lung capacity, drain excess fluid from my lungs." The answer is B. The use of an incentive spirometer will promote the expansion of the lungs. The patient should try to reach the inspiratory target volume achieved before surgery on the spirometer. Phase 1 will begin when the patient leaves the operating room. It will extend from the time the patient leaves the operating room to the time when they are stabilized in the recovery room or the ambulatory recovery area. They need to meet the discharge criteria, and then they're transferred to the nursing unit or another location. During phase 1, close monitoring is required. For the first 1 to 2 hours, the focus is on assessing for after effects of anesthesia airway clearance, cardiovascular complications, fluid management, temperature control, and neurological functioning. The patient's condition can change rapidly. Assessments need to be timely, knowledgeable, and accurate due to this rapid change. The type of anesthesia, the nature of the surgery, and the patient's previous condition will determine the phases of recovery and the length of time spent on the acute care unit. The student positions the patient to maintain a patent airway and notes that the respirations are 12 breaths per minute and unlabored. Airway is clear of secretions. No signs of pressure over bony prominences are noted. The intraoperative evaluation occurs during the postoperative phase. One of the greatest concerns is airway obstruction. A number of factors contribute to obstruction, including the history of obstructive sleep apnea, weak pharyngeal or laryngeal muscle tone from anesthetics, secretions in the pharynx, bronchial tree or trachea, and laryngeal or subglottic edema. Routinely, a patient who received general anesthesia does not drink fluids in postoperative care unit because of the reduced peristalsis, risk of nausea and vomiting, grogginess from general anesthesia, and the lack of a gag reflex. In the case of ambulatory surgery, once the patient awakens in the recovery area and feels no nausea, ice chips or clear liquids will be provided in small amounts. Inpatients may remain in post-anesthesia care until their condition stabilizes. Then they return to the postoperative nursing unit for either continuing phase 2 or phase 3 of convalescence. Nursing care focuses on returning the patient to a relatively functional level of wellness as soon as possible. When a patient arrives on an acute care unit, the vital signs will be monitored according to institutional policy. Routinely, vital signs are checked every 15 minutes twice, every 30 minutes twice, and then hourly for 2 hours. And then they are every 4 hours or per the physician's orders. As the patient stabilizes, it is important to assess the patient's and the family's expectations for recovery and convalescence once they return home. In rare instances, a genetic disorder known as malignant hyperthermia, which is a life-threatening complication of anesthesia, may develop. This is a hypermetabolic state that occurs within skeletal muscle cells that become triggered by anesthesia. Concerns that the student should have for the patient at this point would be IV fluids were discontinued just before the patient left post-op anesthesia care unit. He was able to tolerate a clear liquid diet and is passing flatus. The patient rates the pain as a 7 on a scale of 0 to 10 and continuing to note some discomfort in the shoulder area. The pain has been controlled with oral pain medication, which the patient is receiving every 3 to 4 hours around the clock. The patient's vital signs are within normal limits compared with preoperative values, and his lungs are clear on auscultation. The 4 small abdominal puncture wounds are without drainage or redness. Determine the status of preoperative nursing diagnosis by clustering new postoperative assessment data. Then either revise or resolve preoperative diagnoses and identify relevant new nursing diagnoses after surgery. Routine postoperative orders may include the frequency of monitoring vital signs, the types of intravenous fluids and rates of infusion, postoperative medications, the resumption of any preoperative medications, fluids that are allowed by mouth or orally, the level of activity that the patient can resume, measures to prevent deep vein thrombosis, the positioning that the patient is to maintain while in bed, the intake and output and daily weights, any laboratory tests or X-ray film studies, and any special directions. The primary causes for postoperative complications will include impaired healing of the surgical wound, the effects of prolonged immobilization during surgery and recovery, and the influence of anesthesia and analgesics. Hospitals have instituted purposeful hourly rounding to improve nurse responsiveness and patient satisfaction. Purposeful hourly rounding include the 4 P's: pain, potty, positioning, and periphery. In the postoperative period, the nurse, the patient, and the family collaborate to prepare the patient for discharge. Patients often must continue their own wound care, follow activity or diet restrictions, continuing medications, and observe for signs and symptoms of complications when they return home. Education for the preparation of patients to assume self-care is an ongoing process throughout hospitalization. It is important to provide specific, culturally appropriate, and accurate verbal as well as written discharge instructions to enhance the ability of the patient to care for themselves at home. Postoperatively, the nurse instructs the patient to perform leg exercises every hour to maintain muscle tone, assess range of motion, exercise fatigued muscles, increase venous return. The answer is D. Postoperative exercises help to prevent pulmonary and vascular complications. Encouraging the patient to perform leg exercises at least every hour while awake. Exercise may be contraindicated in an extremity with a vascular repair or realignment of a fractured bone or torn cartilage. The student nurse should provide some more education before the patient leaves. The student should show the daughters the puncture sites and that they are able to identify any complications or symptoms of complications. The patient plans to stay with one of the daughters over the weekend. The student should make a follow-up surgical appointment for the patient and provide him the surgeon's phone number in case the patient has any questions or concerns once he returns home. The student should write the documentation note on discharge, which includes describing the abdominal puncture sites as dry and intact without redness, discharge teaching, activity restrictions, follow-up appointment time, date, and place, and that the patient and daughters verbalize understanding of all discharge instructions. Postoperative evaluation, the nurse needs to assess for any pain and if the patient can provide self-care management. Ensuring patient safety is an essential role of the professional nurse. To ensure patient safety, Communicate clearly with other members of the healthcare team. Assess and incorporate the patient's priorities of care and preferences, and use the best evidence when making decisions about the patient's care.